Light speed neurofeedback, EEG modulated pulsed near infrared transcranial photobiomodulation. Take it away.
One of my primary interests when I was trying to design these types of protocols was I know that neurofeedback can be pretty effective, and I know that photobiomodulation can also be clinically effective, and I was wondering if we put them together, if they would have an enhanced efficacy, if there were elements to combining them that would create more clinical effects. And so part of what was interesting to me about this is that there's some fairly promising research, I think, that indicates that there's a certain synaptogenetic potential with photobiomodulation, synaptogenetic meaning the formation of new synapses. And so one of the advantages of the type of neurofeedback that I've specialized in for the last 10 or 15 years is that there's a very strong component of providing feedback based on connectivity metrics. So let me go ahead and tell you a little bit about the neurofeedback I do, and then tell you how we're incorporating photobiomodulation into it. This slide that you're looking at right now is a screenshot of some of the screens that I use when I'm doing neurofeedback, and these are specifically for me as a clinician. The reason I'm showing them to you, like these wouldn't be screens necessarily the client would see as feedback, but the reason I'm showing them to you is because if you look down on the bottom right-hand corner, there's a couple of thermometers, and you'll notice there's a gray one that says current rate at the bottom, and then a purple one that says stem. And one of the design elements that makes this kind of a unique approach is that when you do photobiomodulation and you stim somebody, or you introduce the photobiomodulation into their biosphere, however you want to call it, when you give them that type of light information, we're essentially trusting on the innate capability of that system to take in that information and do something useful with it. But depending on how compromised a system can be, it may have less ability to do something helpful with that information. So this is why sometimes people can get a little overstimulated, or their central nervous system can respond with less organization sometimes when we use stimulation therapies. And this is why not everybody responds in the same way, because depending on the level of compromise to your functionality, you may have a harder time figuring out how to incorporate in that stimulation usefully, right? So one of the nice effects of neurofeedback is that we can select specific brain areas and specific brain behaviors to base feedback on. We can actually ask the brain to pay more attention to a specific location or a specific behavioral set, and then when they increase in a behavior that we think will be helpful, that's when they get the feedback. So that really lets us be a little selective with what we're asking the brain to do. And so with stimulation therapies, they can be quite efficacious. They really ask the brain to pay attention in a pretty direct way. They're not so much feedback as feed forward. We're going to introduce some information. We're going to essentially just ask the brain to resonate with this. But they don't always come with the organizational and guidance capabilities that you can have with neurofeedback. So the screen that you're looking at right now is one of my designs that combines photobiomodulation and neurofeedback, right? And so those thermometers I drew your attention to previously allow for me to do a couple things. One of them is if I set this purple thermometer up on constant, which it's not going to move. I would normally, if it was the live screen, I would just click this little guy and just drag it up and shift it to constant. Then the photobiomodulation would simply stem off and on parallel and independent to the neurofeedback I was doing. But if I put it on contingent, then the photobiomodulation actually will turn off and on based on the thresholding of the neurofeedback. So we already know that neurofeedback and photobiomodulation work pretty well sequentially, and we know that they can work fairly well concurrently, even if you run them parallel. But at this point, I don't know who else is doing EEG modulated photobiomodulation so that it's turning off and on specifically based on the neurofeedback metrics.
Okay.
So
okay.
Yeah.
That was deep. That was cool. Let me ask you this then.
Yes.
You would go much further. So what you're saying, if I understand correctly, is that you're going to put a stimulation via light into the patient's head. And not only this, so some people are saying, well, the light can't go through the head. Okay, so we're going to talk about your parameters in a minute. But then you're saying, okay, then it's going to have an effect. Some people say, well, it's not really going to have an effect. And then you're saying that you can create some sort of synergy of light stimulation based on frequency. Is that what I'm understanding you telling me?
Yeah, so any stimulation, any stimuli that hits our sensory array essentially is just information. So light, sound, color, smell, vibration, all of it's just information. Pretty much everything, all information is frequency based to a degree, right? And so what ends up happening is, we're walking around in the world, we're looking at stuff, we're hearing things, we're feeling things, all the sensory inputs that are to a degree frequency based, all of them are just informational spheres that our central nervous system is regularly assessing and evaluating for whether or not it's relevant or interesting or useful to us, which is why we pay more attention to some things and less attention to other things. And the brain prioritizes resource recruitment based on attention. So our interest and the efficacy to a degree of how a stimulus feedback loop works depends on how interesting our brain finds something, and to a degree that depends on how much it draws our attention, right? So I'm going to show you a couple more slides that might help to illustrate essentially how we're doing it. Okay, so from this slide, the only thing I really wanted you to get is that the design allows for us to turn the photobiomodulation off and on based on whether or not the EEG metrics we've selected to do the feedback on are changing. So we've essentially made the photobiomodulation an element of feedback, which is a little bit unique.
So you built this stuff, these little things, that's you. You built these things over here.
So I'm collaborating with two different companies. I'm collaborating with Brainmaster Technologies, and I'm collaborating with V-Light. So I'm utilizing the V-Light diodes, the V-Light LED diodes, to do the photobiomodulation, and I'm utilizing the Brainmaster software and some help from the tech support people who are lovely to help me make sure my designs are working properly.
Lovely. Well done.
Okay. So, brief breakdown. What you guys are looking at on this slide are the 8 locations that I used to actively monitor EEG. And these were selected because one of the things that really is nice about the specific type of neurofeedback that I do is that, I'm going to go one more slide and then maybe bounce back, is that I'm actually able to monitor in real time all the frequency bands that you see here. So everything from delta to gamma, which I remember correctly runs up to about 45 or 50 hertz on this particular breakout. And so I'm able to individually monitor all of these frequency bands. And then I'm also able, in each of these frequency bands, to monitor the behaviors between every single potential pair. And so that lets me actually look at connectivity behaviors between locations. So that means that I've got all of these sites hooked up, and I'm able to monitor several types of connectivity behaviors between every potential pairing. So that means I get front to back and side to side networking monitoring, right? So that means I can provide feedback on how good of a job the brain is doing, exchanging information and connecting between all of these sites. And that allows for me, it's a little bit of a unique option because it really allows a lot of, let's maybe call it network flexibility, right? Because one of the ways that we determine whether or not a brain is healthy and functional is whether or not it's able to appropriately shift between different tasks in its capacity to recruit areas together to focus on something and then uncouple them, recruit another set together to focus on a different thing and then uncouple them. And its flexibility and shift state shiftability is one of the ways that we measure how healthy somebody's brain is, right? If you get a little bit stuck on something, you don't shift well, or you have trouble recruiting an area in so that you can't really do the networking procedures that would utilize it, then, this is usually what reduces function. So
you're going to be able to see this. So that's a lot of information coming at your screen, because all these connections can happen anytime, but you're going to be able to watch it and kind of monitor how the stuff is going, right?
There's actually 900 metrics that the program actually monitors for us in real time and provides feedback based on how well the brain is meeting the metrics. So what I'm doing is something called Z-score training, but it's a little bit different, where we're actually out of all those 900 metrics, what we're actually doing is giving feedback on whether or not a percentage of those parts of the brain that we're measuring, we're looking at the behavior and we're saying, how similarly does this brain behave to a typical behavioral set, like a normative range? So when a certain percentage of these metrics that we're looking at come within a range, then the brain gets feedback saying, oh good, a pretty significant part of your networking behavior locally and, globally, we're looking at the behaviors and we're saying when your brain acts a little bit more like a brain that behaves efficiently, you get your feedback.
You get the little positive thing. So can I just ask, can we describe this as other people have kind of described it as bandwidth or flexibility within the brain waves, if you will, the brain connectivity or function, if you want to call it that? I don't know how far I can go with what the QEEG is measuring a function, but is it bandwidth, ability to go over here, come back over here, go over here, come back over here? Otherwise, you might be kind of limited in your flexibility here. Is that an accurate assessment?
Yeah, so I'm going to show you some pictures in just a minute that I hope will be a little bit helpful. But if you look at the frequency band list here, delta and theta are slower frequencies. The betas and gammas are faster frequencies. And then the alphas are frequencies that are in the middle of slow and fast. So the slow frequencies, we essentially slow down into delta and theta to do things like nutritionally support, recruit resources up into the cortex, sleep, repair areas that are injured. All of that internal infrastructure building stuff comes in the slow wave states. And then we speed up the brain into the betas and gammas to pay attention to what's going on around us and incorporate all that information in and do more focused, concentrated, engaged tasks. We got alpha in the middle that essentially shifts between. So when you're hanging out in alpha, you have the capacity to kind of slow down or speed up. So for example, some people get a little bit stuck in the betas and gammas. So they're a little strung up, a little high key, a little anxious maybe. And some people can get a little bit stuck in the slow wave. So they have more trouble engaging and focusing. And what we're looking for is helping a brain be able to flexibly shift back and forth between the fast and slow states appropriately based on what the environmental demand is. So
beautiful. I mean, I want to focus you to look at Mika Schanzer's talk on flow state and how he breaks it down into the different bands. Really cool. Keep going, Bear. I love it.
Excellent. So we're monitoring what's happening in all the bands so that we can get a good feel for how the brain's able to shift back and forth. So this is what we're looking at with the protocol. This is how we're giving the feedback. But the actual feedback ends up being a combination of sound and visual. So what ends up happening is the person who's receiving the feedback, who's doing the neurofeedback training, they'll hear a series of sounds that increase and decrease in pitch. And as the sounds, as the brain does more of the behavior we're looking for, the sounds will increase in pitch, right? So they basically go up and down, up and down. And the reason for this is that the more higher pitched the sound, the harder the brain, the harder of a time the central nervous system has ignoring it. And so as anybody knows who's been around high-pitched shrieking children, you know, the higher that pitch, the more sort of piercing it is, the more attention gathering it is. So as we essentially go up and down, increase, decrease in frequency, the higher pitches draw the brain's attention a little bit more. And so the brain goes, why, what are those higher pitches? And so because the brain is interested it will actually shift behavioral sets to try to create more high pitch, right? Meanwhile, the visual component actually allows, we have a little screen that we can put over anything, a Netflix show, a YouTube video, an article somebody is reading, a game, whatever. We've got a little screen that dims and lightens. So as the auditory pitches go up, the screen actually gets brighter and more visible. As the pitches go down, the screen actually gets darker and it's harder to see. So it's actually an integrated auditory visual feedback, right? So the more the brain matches what we want, the lighter the screen gets, the higher the pitch gets. Now, it's important, and the reason I'm kind of explaining in detail is that when I talk about how the brain prioritizes resources, it prioritizes resources based on how we pay attention. And we do attention two ways. We either purposefully ourselves attend to a thing, or the environment draws our attention with a certain, production of stimulus, right? So when we talk about training, how do we get good at something? We do a thing over and over and over again, and at the beginning it's really hard and it really tires us out, but the brain goes, oh, you want to keep doing this thing? That's cool. I can't be just, dumping constant energy resources into this, so let's figure out how to do it, routinize the pathways we would use to do this task, make it as energy efficient as possible, and then you become good at it. It becomes reflexive, right? That's what training is. Doing something repeatedly until your brain makes it efficient and it's easier to do. So you can either yourself attend to a thing that you do repetitively, or your environment can train you by drawing your attention to something repetitively. And since auditory and visual inputs are very attention orienting for the brain, when we do neurofeedback, there's an inferior, and actually let me do this one real quick. Which slide do I want to do first? This one. Sorry. Actually, I think what I'm going to do is swap these slides around so that the ones you guys are a little bit more in order. Okay. There's an inferior and a superior colliculi at the bottom of your brain, and the superior colliculus actually is recruited by visual inputs from your visual cortex, and the inferior colliculus is recruited by inputs from your auditory cortex. And your colliculi are actually responsible for the orientation of your attention in space. So if you give somebody a visual and an auditory input that's integrated, you're actually getting both of those colliculi simultaneously. So you're really able to capture a significant part of that brain's attention.
And I said something about attention, and the reason that this is put together neurophysiologically is because you have to look and see a sound. When you hear something in the bushes or a cracker, you have to look and see at the same time. So that's why they're kind of put close together.
Yeah, and I a big part of the reason that I talk about this is because you can do either visual or auditory feedback, and both of those are pretty effective. But if you can combine them in an integrated way, you will get more efficacious effects. You'll get better effects. And so, so my specific neurofeedback designs, as much as possible, I try to rely on an integrated model if I can, right? So the actual feedback that people get is a visual and an auditory sound, and that's the neurofeedback element. Now, by itself, that's pretty effective for most people. But a couple years ago, maybe 2 years ago, I think you have another session with Dr. Lou Lim from V-Light. He was actually the first person, currently the only person, who gave me permission to integrate their V-Light LEDs into the BrainMaster program so that I could drive the LEDs utilizing our software, right? And what I would like to do here, Thomas earlier talked about how they were using the alpha V-Light. So, the V-Lights put out a handful of pretty cool products. But two of their standbys are their alpha and their gamma V-Lights, which the alpha one stems at a 10 hertz frequency, the gamma one stems at a 40 hertz frequency, right?
Right.
And one of the things I wanted to be able to do was actually pick any frequency I wanted. So when I drive this with the adapted software, I'm actually able to select any frequency I want between 0 and 100 hertz. We could actually go higher, but for this design that I give people, I usually top it out at 100 hertz, because once you start sending at much higher frequencies, people have they can have some interesting effects, and not everybody's in a space to manage that in the fun and entertaining ways that it can occur. So since we're going more sort of for, clinical effects and less for floaty, disassociative, exciting effects, I mainly top it out at 100 hertz, because most of the EEG clinical frequencies that we work in tend to be between maybe 1 and about 45 or 50 hertz, right? So I can actually select what frequency I wanted to stim at. So what that's allowed me to do is this V-light that you're seeing here, essentially I've got 4 diodes, and I can kind of move them around the head. I can swap it around and put the 3 in the front or do whatever. I actually have some loose diodes now, and I'm playing a little bit with different combinations. But this would essentially be the setup I've used on the couple of clinical cases. I think one of them I flipped it around and put the 3 in the front, which I'll explain when I get there. But that's basically my setup. I've got those 8 electrodes on the head. I've got this V-light headset on the head, and that's what I'm using to do these sessions.
So what we're not seeing here is the EEG setup. This is just the
correct
the light, the V-light.
Correct. The EEG
so people don't get ahead.
This would be the EEG setup, and then what I did is I basically finagled the diodes in between the electrodes so that I didn't have diodes directly on top of the electrodes. Now here's what's really interesting is that a lot of people huff and puff and say you can't do STEM at the same time that you do EEG because it corrupts the EEG, but there's a couple of ways to work around that. One of them is it's not like we're walking around in some sort of purest frequency soup every day. We're just spanned with all sorts of overlapping frequencies all the time, and our brain is regularly sorting them out. So, I mean, our brains are more capable of sorting out different inputs than we think, or than we assume. And I think most of the time people are just uncomfortable with the complexity of layering things, and so they feel more comfortable just doing maybe 1 or 2 things, and that's completely okay.
That's okay, because the word that we're talking about, you're stacking things like that. And so it's like there's a difference between can't do it and won't do it because I don't understand it or I'm not interested in it. Or what is this going to do? I don't have it. Yeah, it's a nice thing if you think about it, but you actually did it. What happens if you do this? Well, you could, and you actually did it. So.
Yeah, that's pretty much my general approach to life. I wonder what happens if I do this.
Mm-hmm.
So that's the basic setup. And I'm actually pretty excited that Thomas talked about how the alpha peak frequency normalizes, because I have a couple of pictures. I've got some pre and post images of a few cases, and I'll try to go through them pretty rapidly.
No rush.
So I was pretty excited when Thomas was talking about the alpha peak frequency, because that is also a thing that I have noticed. So I did a couple cases. Well, I've done a number of cases by now, and out of the ones I'm showing you, this first one I actually selected the 10 hertz to stim at, because what I also wanted to do was track, like if someone just had a 10 hertz or a 40 hertz V-light and that's what they were using, maybe sequentially with some neurofeedback, I also wanted to demonstrate a little bit that, that efficacy, right? So even though I'm going to go real off label here in a minute with the frequency selection, this would be a standard frequency that a V-light would stim at that you could purchase, right? Mm-hmm. And so this particular case was a woman that I worked with who really had a lot of social anxiety, and one of her significant difficulties was being able to make decisions as soon as she gets stressed out. Some people are fight or flight. She's a 100% freeze. When she starts to get stressed out, she just sort of locks down and has trouble with executive function, making decisions, sorting information, even just accessing things that she already knows. She just kind of freaks out a little bit, easily socially anxious. And so what you guys are looking at here is a pre and post image. And what's kind of interesting, these are alpha peak frequency maps. So I also attempted to include, like, this little visual that you see here. These are all the all these little black dots are actually places where electrodes are. And so anywhere you see F's is like the front, and then C's would be over the central, T would be around the temporals, some O's for occipital, and some P's for parietal, right? So we're looking at pretty much the full cortex here. And you'll notice on this one that she's got a pretty slow alpha peak frequency over here. The blue means slower alpha activity, whereas the orangey red means faster alpha activity. This tells us if you hang out slower in the alpha range, then you're more likely, like you'll see here, like the peak frequency is running like 7-8 hertz, right? This is pretty slow. This is actually the z-score of how typical that activity would be, right? So you guys can see that there's like some fairly low z-scores here saying, hey, this is a little bit slower than we would typically see for an adult her age, right? And you'll notice the front of her brain is doing something completely different, much faster alpha. So we're looking at two things that are interesting. One is that when you have alpha that hangs out in the higher end of the range, then that part of the brain is much easily sped up into engagement. When you have alpha that's hanging out in the lower end of the range, that area of the brain has a harder time speeding up and tends to stay maybe hanging out in the slower task behaviors. So we've got a part of our brain that's really kind of stuck in slow, and a part of our brain that's hanging out definitely in the easily recruitable for fast. But the second element of note is that that's a very disintegrated behavioral set. There's not a lot of synchrony between the front and sort of this left central area of her brain. And so when you have areas of the brain that are not synchronizing well, then they often have a lot of trouble with that network informational exchange. You have trouble with the global recruitment and trouble with the state shifting. It's easier to get stuck. Yeah? So you can see, I did a session on her, and this is 48 hours later. You can see that there's been a significant change in the general synchrony. Almost all her frequencies ended up hanging around maybe about a 9 to 10 hertz, right? So there's a lot more similarity in behavior, which makes it a little easier for that state shift to occur between fast and slow. But I want to point out that this left temporal area here still stayed pretty slow, right? That's that little T5, 7.9 hertz, still stays slow. And what I'd like to discuss is that one of the specific things she has trouble with is recruiting her verbal access. When she gets stressed out, her verbal access, she basically just can't talk. When she hits a certain stress threshold, she really freezes. And so her report was after her session, she felt much less stressed in general. It was easier for her to interact in a social situation. It was easier for her to pay attention and engage, but she didn't notice any improvement in her verbal access. And I said, well, you know what? That makes sense, because we can see where your brain sorted out a few things, but we can see where this area of your brain actually shifted over. And because here's what's interesting about brains. You give it information, they update their priorities, right? They learn new things, but once they can't fix everything at once. So they'll tend to work on something, and as they're working on one thing, you'll see other stuff maybe get a little bit under-resourced, right? And so you'll see prioritization sometimes move around in that networking as the brain focuses on essentially working on different things. So this is one of the things that's really cool about brain maps, is being able to see what the brain's focusing on as it's going through the infrastructure building or integration process. Does that make sense?
That's looking at the brain in real time. That's what you're talking about just now. You're watching the brain process this as it's removing these resources around versus the snapshot that some people are looking at, correct?
Correct. So these images are obviously sort of an average snapshot, but they're a snapshot of an actual dynamic process, because what we've done is we've measured it over several minutes and then kind of averaged out the behavior and been like, this is the rough average behavior of that dynamic network, right? So, yes. So, same person. Remember I was telling you guys how I was very interested in the connectivity, the networking capabilities. On the left side, you've got the pre, and on the right side, you've got the post image. And in this particular measurement, coherence. Coherence is essentially an indicator of how efficiently the brain is able to exchange information in between different areas. So again, the little dots are EEG electrodes. We're basically measuring network behaviors and how effectively or efficiently the brain can exchange information between them. So on the left side, the blue means anywhere you see blue is where the brain's having more difficulty with that informational exchange. White means roughly normal or typical, what we would expect, right? And so you'll notice that this is 1 to 20 hertz. Like each one of these little heads is, here's what she's doing in 2 hertz. Here's what she's doing in 13 hertz, right? We're actually getting a very detailed breakout of how her brain's engaging in those network behaviors. And you'll notice that after, essentially 48 hours after her session, there's a significant change in the connectivity behavior in her brain. This is the maybe sort of the 1 to 20 hertz. This is actually the 21 to 40 hertz. So we have a fairly full spectral measurement, right? And you can see she was having trouble all the way through that spectrum with efficiently connecting in the network. Even though we only did 8 sites out of these, these 19, you can see that even though just the connectivity feedback of those 8 sites informed her ability to make some shifts to make those connections a little bit more efficient. So we went from struggling to connect and exchange information to a fairly typical, maybe a measurement that we would expect, right? Anywhere you don't see blue lines is quote unquote normal or typical.
Gotcha.
Sorry?
Gotcha.
Yeah, pretty cool, huh?
Yeah.
So, because remember my original thing was, hey, I can give feedback on connectivity and network behavior. Hey, photobiomodulation has a lot of potential for synaptic genetic, a behavior, right? The formation of new synapses. And how do you improve network behavior? To improve network behavior, you basically have to build new infrastructure. You have to form new synapses to improve how the brain essentially talks to itself across regions. And so I was like, this is why I'm showing you guys the connectivity images, is because that's what I was kind of hoping would happen. And to see the pre and post after just a session have that level of shift was really encouraging. What is also very interesting too, so that was, my apologies, this was her eyes closed, pre and post, eyes closed. This was her eyes open. And again, slow frequencies, you'll notice that she went from really underconnected to a significant increase in connection. And one of the things that we do know from a history of doing quantitative EEG brain maps is that sometimes when you see an excess of coherence, the red lines meaning way more connectivity than we would typically expect. When you see an excess, you can have a deficit of connectivity without organization, but you can't have an excess of connectivity without organization. And I see this in a lot of my brain maps where I work on people, and they'll go from, maybe an underconnectivity framework to hyperconnection, right? Or hypercoherence. And I often see this in sort of my middle stage brain maps as I'm working through a treatment arc, because there's an increase in activity. Remember I was telling you, when you give the brain a new task, it temporarily floods areas with resources to learn the new task, and then it routinizes and makes it more efficient. You can see in her eyes open state, she was actually increasing she didn't just normalize it, she actually increased it to try to build new sort of delta and theta behaviors, right. Which, if her brain's having trouble with recruiting memory and accessing verbal capabilities, she really needs that delta theta increase to underline the resource recruitment and the repair, and also the access, right, to the lower brain areas. So this is really pretty interesting.
So that's also in the frontal area. She had a very high alpha, and now she's bringing it down into the lower hertz thing. So you're seeing that you're actually great interpretation that you're seeing that reorganization actually happen, kind of watching it grow.
It's really a really interesting case. And this was her 21 to 40 hertz, eyes open. And you can see, again, she normalized or, sort of cleaned up a little bit her difficulties just specifically with that. But, it really is interesting. Even though I'm only stimming at 10 hertz, we're seeing full spectrum effects where her brain's doing all sorts of different effects. And to a degree, I think the photobiomodulation simply affects across the spectrum anyways, because whenever you ask the brain to change something, everything in the brain reorganizes around that. But when you add the photobiomodulation at, even just a single frequency, when you add that with all the frequency feedback we can get from the neurofeedback, we actually can enhance the full spectrum effect of the photobiomodulation.
Cool.
I know, right?
One treatment.
That was one treatment.
One treatment.
This is a totally different case with 4 treatments. No, I'm sorry, 3 sessions. Yeah, 3 sessions. And forgive me, it's a very busy slide. I tried to cram a lot into a small space, but let me break it down right quick. These are the coherence maps that we had just looked at, and these are the alpha peak frequency maps. Mm-hmm. So this first one, this is the 21 to 40. So we're looking at betas and gammas here, right? That fast frequency. This was an individual I was working with who had a lot of difficulty with perseverance, getting very obsessed with things, very OCD, had a lot of trouble state shifting, not a lot of flexibility. So he'd get zoned in on something and it would really affect his ability to do work or his ability to interact with people. Pretty strong obsessive behavioral set. And so we did 3 sessions, again, alpha, because I was kind of looking for that state shift ability. And I also, you can see, like this far left one is before we did anything. This is pre anything, right? So this is his baseline we were working with. These are his alpha peak frequency. You can see how disintegrated and unsynchronized his alpha is, right? And then you can also see how the infrastructure here, the connectivity network is hyper connected, right? Probably to a degree a little bit driving his hyper focus, yeah? And so we did about 1 session a week over a couple of weeks. And what I did was, he came in, I did this map and I did a session and I waited a week. And then he came in, I did another map and then I did a session, waited another week, came in. And so what you're able to see is over the course of several weeks and a couple of sessions, you can see how his brain sort of bounced around, trying to kind of find the best way to reorganize itself. So, you've got these sort of complex coherence global behaviors. Meanwhile, you've got your alpha peak frequency getting a handle on how to be a little bit more synchronized, allowing easier state shift. So even though his alpha peak frequency, which makes sense because, we were working with that 10 hertz again, same 10 hertz, different case, same 10 hertz. You can see how that alpha peak frequency did chill out and kind of reorganize and normalize itself. Meanwhile, his coherence is bouncing around a little bit, trying to figure out the best, most effective way to sort of support that increased state flexibility. So I don't really care personally whether or not the map is all clean and normal because nobody's normal. What I care is giving the brain updated information so that it can come up with new strategies that just work better, right? So, if you still have blue or red lines, that's fine. All it's doing is letting me know what your brain's prioritizing.
So, the reality of it is you're just merely nudging this brain. You're once a week for how many minutes? And just tapping it a little bit. That's pretty amazing.
And maybe a good way of saying it is I'm asking it to pay attention to certain things. The photobiomodulation is asking the brain to pay attention to 10 hertz behavior. And the neurofeedback is asking the brain to pay attention to its networking in between those 8 sites, which remember gives us front to back and side to side, right? So when we ask the brain to pay attention to both of those things simultaneously, it kind of has to make them work together to be able to do the task request, right?
All right. So let me just ask you a question here. So on the first lady, did she have neurofeedback and the light or just the light?
Every person you're looking at has that same 8-channel neurofeedback and the light.
And the light. So then again, my question is, well, you'll probably get to it, so I'll let you go, and I'll ask it in a moment.
Go ahead, and I'll keep it in mind just in case I wouldn't answer it.
Well, I'm asking, so do you feel that since you're putting them together and looking at them kind of happening, do you feel that it's that there's more of a metabolic assistance with the light, or are you feeling it that it's a more modulation of frequency with the light?
Yes.
Okay, girl, that's what I thought you would say. But so let me turn it around another way. Why does it listen to 10 hertz? Would it listen to any hertz you put in? So I know you're going to talk about that as you move forward. So go ahead.
Yes. So I actually have a specific case because, again, we're sort of looking at full spectrum, but not everybody's brain responds in the same way. Some people just have a lot more allostatic load on their system. They're working with inflammation. They're working with poor nutrition. They're working with maybe some medical issues, because one of the things we have to remember is that when we work with neurofeedback, we're primarily working with pyramidal or cortical neuronal behavior. So, I mean, we can only really estimate so far into the brain. So mainly we're working with the cortex, like the brain that's kind of at the top, right? Mm-hmm. So even though we can so I was talking about the inferior and superior colliculi, but the only reason I'm able to kind of access those is I'm putting in cortical inputs, right? The visual and auditory are still cortical. So there's loops between the subcortical, like the bottom of the brain and the top of the brain. We're kind of working with the top of the brain, right? And so if you can think about how the brain recruits resources, pretty much all of our resources come from what we put into our bodies. And so when you're breaking stuff down in your gut, it's getting recruited up your central nervous system. So it hits that brainstem, then it hits those lower limbic brain structures, and then it hits the cortex. So there's a whole process for you to recruit usable resources up into the cortex, which is what we're working with, right? We're basing feedback on the behavior in the cortex. But your ability to recruit those resources up is based on a lot of things. So if you have systemic inflammatory issues, or you have other medical concerns, or things where your system's struggling to monitor other elements of the system, then you're actually going to have some competition for those resources. Your cortex ends up sometimes getting a little bit under-resourced. And I really think that the metabolic elements of having some type of physical stim helps to, I think, encourage the recruitment of the resources all the way up into the cortex. And I think it's really quite helpful.
That's exactly that. That's exactly what we've seen with the presentations, that you're going to, I'm going to just put it this way. If you get a light penetration into your cortex, you're going to have more metabolic activity, even if you're not thinking more. It's just something's going to turn up a little bit. So it's going to call attention to that area. Light is going to bring the metabolic aspects to that area. And that's, like you said, allow you to kind of recruit that zone. That zone's going to get perfused.
A little time.
You can look at it all the way to the intravascular type of stuff, that they're going to go in there and open up those vessels, with the light, like our doctor from Russia, Dr. Ivan. But as you get more resources, that's a great way to say it, to the brain, to the cortex, good things tend to happen in certain degrees. Go ahead, dear.
Okay, so I've got 2 more cases, and I'll be pretty quick, and you are obviously welcome to edit whatever you like.
Thank you.
Where's my little pointer? Oh no, my pointer is being fussy. It's fine. I have a touch screen. We can survive this. This next case was really kind of interesting because I didn't see like dramatic shifts in the power. This is a case where I've got somebody who I've been working off and on with for probably maybe 10 years, who just has a regular daily alcohol use, terrible nutrition, borderline features, just has a lot of trouble functioning in general, and he's a very slow responder to treatments, right? So we've sort of worked with him off and on, and mainly what we do is try to maintain functionality, but we tried this on him as well, and I just did like 2 sessions, but I actually selected I did a stim at 4 and 5 hertz, because one of the things he really has trouble with is just a predominance of excess theta in his brain, and which we've had a lot of trouble sort of shifting or modulating, because we can't override all the other things he's putting in his body on a regular basis. Like, you put garbage into your body and you compete with your brain for those resources. There's only so much we can really do in that environment. But, I really do like to try the worst possible cases to see what we can get out of it. And so with him in specific, I'm going to show you guys, left side is pre the 2 sessions, right side is post, and this is specifically 4 hertz. This is an S-Loretta slicing of 4 hertz behavior, and the top left-hand corner is the very bottom slice of the brain. Like, let's say you're going to slice the brain from like the bottom all the way to the top. The top left corner is the bottom, and it slices all the way up to the bottom right corner, which is the very top slice of the brain. So you literally can see the behavior from the bottom to the top of the brain if you kind of look from left to right, yeah? So this is how much 4 hertz he was making, and you can see pre and post, he did reduce a little bit that 4 hertz, and this next one is 5 hertz. You can see, again, there was a little change, but not really dramatic. To be fair, 2 sessions with this guy who we know is a slow responder. So like, yeah, that's reasonable. And then I went over and I looked at his pre and post coherence. And look at the 3 and 4 hertz on the post over on the right. So if you look at the top row, you'll notice he didn't get that full spectrum shift that we saw with our couple other cases. It was really kind of specific, that little shift that sort of happened there. So he was like, I actually felt more chill, a little bit less high strung. He reported he noticed feeling a little bit better. Again, we weren't expecting miracles with him. I was mainly just interested in if I added this photobiomodulation and I stemmed at a specific frequency that I knew he was having some trouble with, would his brain respond to that? And that little 3 to 4 hertz change was pretty interesting to me.
Think about it, that it's sort of like, instead of having it, to put it in your terms, if I can, if he had the resources to have this thing reflect out into the rest of the bandwidth type of thing, we may have seen the change. But it's so good to see like a brain on fire, and you say, I'm going to squirt a little water on this area here. Let me see if I put out the fire a little bit. Boom. Oh, other people, you give it a little water, maybe it's going to pass to the other areas, but at least you're seeing the thing that you're trying to do. You're seeing the thing that you're trying to think, right?
Yeah, isolating out effects obviously is very difficult in clinical work because, part of my ethical stance as doing clinical research is that I as much as possible, I try to do what I think will really provide them with the improvements we're looking for functionally. And then my secondary concern is sort of is figuring out what exactly did it. Now, I'm very interested in what exactly did it because I'm interested in replication. But it's not always easily clear to me which elements of the combination of things I did had which effects. So for me, it's always pretty fun when I get to see something that's really quite specific. And this was very encouraging for me about the specificity of selecting frequencies using the V-Light.
Cool.
Okay, one last case and then I am done. This last one, I did something different again. So I've done a lot of work with combining pulsed electromagnetic frequency and pulsed electromagnetic field, which has frequencies in it. So pulsing electromagnetic field frequencies is also another therapeutic stim option. And so I've done a lot of work over the years combining that with neurofeedback. And one of the things I had a lot of efficacy with was doing essentially some ramping frequencies where I'd pick a frequency band and I'd kind of ramp pulse EMF frequencies through that band, trying to get some wider band effects, right?
Oh.
Yeah. And so I was like, let me try this with the V-Light. So what I did was I did about maybe a 30-ish, 20 to 30 minute session, same 8 channels, same neurofeedback, but instead of just hammering at one sort of selected frequency area, I actually ramped up the V-Light. So I changed the frequency it was stimming at. So I started at 25 hertz and I basically did a couple minutes at 25 hertz, bumped it up to 26 for a couple minutes, bumped it up to 27. So I basically did about a 10 hertz ramp over roughly half an hour session. And my interest was, can I potentially affect, sort of a wider beta range? Now, I'm going to show you a pre and post session of this guy. And what's really pretty interesting, so forgive me, what I'm going to do is actually scroll through a number of these pictures over the course of maybe the next couple minutes, because what I'd love for you guys to see is I sent him 25 to 35 hertz. But I'm actually going to take you 1 hertz to 45 and let you see pre-post in every single frequency, because I think it's useful for us to, again, see what is happening across that whole spectrum, when we're using the V-Light. And since I've got the pictures, why not? So this first picture, on the left is his pre, and on the right is his post. And you will notice at the top it says 1 hertz. So this is like his whole brain only in 1 hertz, right? And so what I'm going to do, I'm going to mainly just kind of roll through and possibly stop when I'm a little bit interested in something. But you guys will see, over the course of the next 45 hertz, you'll basically see how his brain reacted. And one of the things that was interesting to me was, obviously I'm stimming up at, 25, 35, which is more of a beta range. So we have 4 hertz, more of a beta range. And so I'm not really expecting a lot of dramatic changes in the slower frequencies, right? So, for me to kind of look and see, like you saw earlier in Delta, there was a little shift. But I'm not really expecting like 5 hertz, 6 hertz. I'm not really expecting anything down here. There's a little kick up in recruitment. I do want to show you this. It's really very interesting. The left temporal. So this particular case, I've got somebody who has significant chronic depression, anhedonia, really antisocial, just does not enjoy interacting with people, low energy, chronically terse, like not very, doesn't easily engage in conversation, just, a person who's just having, a person who just is having trouble interacting.
You got a taste of the grumpies.
It's just real grumpy. And so I'm going to make a quick note at this little left temporal sort of increase, because remember, what the brain maps show us, which is the real utility, is anywhere we're seeing more activity than typical is somewhere where the brain's prioritizing activity and resources. Anywhere that's blue is where it's under prioritizing or prioritizing less, right? And so I don't care so much about everything being normal as I care about understanding what the brain is telling me it's focusing on and what's important to it, so that I can figure out the best ways maybe to support that strategy, right? So when we see the post, when we see an increase in an area, like this is the left temporal back here, that's telling us the brain's decided to work on that. And we know that, the slower frequencies help with resource recruitment. So to see a little pickup in the left and theta there, sort of the back left, especially, like that's all the way at the bottom, right? See that little yellow kind of on that top and second row? Right. That's all the way down, almost like insula level, left temporal, right? So it's interesting to watch where the brain will, here we are 8 hertz, you see it reduces the excess activity, kind of normalizes out. Other areas it'll increase it. You're actually seeing the shift as the brain moves resources around. Look at here, 9 hertz, boomed up in the back. Now, what do we know about alpha? Remember, alpha is about 8 to 12 hertz. We know that if you don't have enough alpha, it's awfully hard to state shift. In between, you get a little stuck. And so if you have sort of an increase in alpha in the back of your head, then sometimes it'll increase that flexibility a little bit. So, we got a guy who's just not really engaging. And I thought it was a little interesting. We saw that alpha kick up, right? Just specifically at 9 hertz. Just 9 hertz.
That's right.
Right? So I'm scrolling through, and mainly what I'm going to do, I'm going to go a little quickly, because this is 12 hertz. You can see, like, what I want you guys to just have the experience of seeing is just how that brain's moving things around in response to what we're doing, right? Now 13 hertz, you'll see, like, it's not that it's, super dramatic, but you can see got these little changes, these interesting little changes that are happening. And that front right cortex there, you'll notice that as we go through, you'll notice the front right cortex. Just keep an eye on that front right cortex, because now we're in 17 hertz. Watch it pick up a little bit here. That right front of the brain is starting to increase in activity. Now remember, we got a guy who's very antisocial. And what is the right front of the brain in charge of? Well, it's in charge of a number of things, but left front of your brain does approach behaviors, right front of the brain does avoidance behaviors, and we got somebody who's real avoidant. Now that right front's starting to activate a little bit more than it was before, right? So I think that's really pretty interesting. Now remember, I don't start stimming till 25 hertz, but we're seeing stuff all the way down into the teens and 20s, right? We're seeing that right frontal activation. Again, these were normal brain maps, and now we've got excess activity based on the, sort of that Z-score distribution. But again, we're interpreting and understanding as more activity. Doesn't mean it's bad. It means the brain's doing something. Yeah. So what does that mean for our guy? Well, now we're headed up to 25 hertz. We're about to hit 25 hertz where I started stimming. What does that mean for our guy? So one of the interesting things about running the photobiomodulation on people is that sometimes you see the effects happen pretty quickly, like within session. And I've got somebody that essentially I can't drag 8 words out of over the course of an hour appointment, right? I mean, obviously he does what he can to give me information, but he's not a talkative guy, not very self-reflective, not very self-aware. And so over the course of the 30-minute session roughly that I was working with him, he started to become talkative. About halfway through, he started just talking. And I was kind of like, oh, okay, that's new. Because at this point, I've been working with him off and on for, a number of sessions. He starts talking. By the end of the session, let me tell you, by the end of the session, this dude won't shut up. And I've never seen him like that. I've been doing some neurofeedback on him, but I hadn't done any photobiomodulation. I hadn't done any STEM. This guy's not shutting up. Like, I literally had to pull all my therapist skills out to kind of manage him and shove him out the door so I wouldn't be too late for my next session. And it was really very interesting because, I have had a few people who've gotten a little keyed up, right? You run the 40 hertz on somebody, you run the faster frequencies, look a little keyed up sometimes, a little more activated. Like, I feel like that's reasonable for sending them with faster frequencies. I really wasn't expecting that with him. And so it was very interesting to me to see that happen in real time, right? And so this is where we're basically sort of ending where I was doing the stem. Yeah. So remember, I went about 25 to 35, but we still got about 10 more frequencies, 10 more hertz that we can look at, which I'll scroll through as I talk about his report back. So at the end of the session, I was like, so how are you feeling? He's like, oh, I don't feel any different. I don't notice any changes. And I'm thinking to myself, are you mad? Like, you have talked almost nonstop for the past 10 to 12 minutes, which I've never seen him do. Just kept talking, wouldn't shut up. And he was like, yeah, I don't notice anything. And I'm going, oh, okay. So his self-report, when he came in for his next session, essentially what he told me that he experienced that he thought was interesting. He said primarily what he noticed was when he went to work the next few days, he hated humanity a little bit less. That is a quote. And he noticed that when he got home at the end of the day, he actually had energy to do some chores. Typically he'd get home and he would just be trashed, right? Just trying to interact with the world was overstimulating for him and exhausting. But he noticed he would get home, he could do a little laundry, he actually make food. And so he was like, yeah, I noticed that happened. That was different for me. And so you'll notice here, which is really quite interesting, I was talking about, maybe an excess activity calming down. Now we've got a deficit in recruitment that's improving or normalizing a little bit, right? You can really see how the behavioral shift in what the brains do. I mean, now we're going from blue, right, to a typical amount of recruitment. And I just, his case was just very interesting to me because, you can see across the spectrum, there's just notable changes and shifts in what's happening, this was only, was it one session? Actually, I'm going to scroll you down to 45 hertz and then swap back over because I'm going to get off here in just 1 second. Yeah, look at that. Now, you'll notice on the pre, all of the blue is on the right. And now in the post, you got just a little bit over on the left. It's just really interesting to watch that move around. Like, the brain essentially shifted. They normalized what's happening on the right, but now the left side is getting a little under-resourced. Okay, what's going on with that? You know, part of what's really fascinating is thinking about that combination between that right frontal cortex, yeah, how that kind of kicked up in activity. And then we've got these sort of temporal regions. Well, I mean, what parts of your brain are in charge of talking? Well, obviously there's a whole array of areas that come together to create talking, but the frontal cortex and the temporal, like the frontal area and the temporal areas tend to be pretty key. And so to see his frontal right frontal cortex really sort of increase in activity and to have like a notable shift, the left side of the brain is commonly recruited for verbal behaviors, right? And so to see suddenly there is a decrease in and so the faster frequencies really do a lot of inhibition. Like they're the ones that allow for the inhibition to take place, right? So to see a reduce in faster frequency inhibition on that left side at the same time as we're seeing an increase in the right front where he's in charge of avoidance, and to suddenly have him just talking nonstop, I thought it was an interesting shift. So
and I think what I'm noticing is that also you're saying the resources. I mean, if you're having that red hyper in this zone here, you're going to have a hypo in another area perhaps. And then if you have a global, you just don't have the juice getting up there, then you can have a global slow down. But you may be a young kid with a lot of, sugar and Red Bull and all that stuff, but you're only going to be able to activate, the brain's going to go high over here and you only got so much glucose.
Right.
You follow, that's what you're saying. I love it.
Yes, and brain maps are a very limited and static way of looking at that. But if you do them a bunch of times in between, introducing stems or therapies, over time you're going to get like a pretty decent, it's like watching a kid grow up. Like, yeah, you're just taking a picture on this day and then taking a picture on that day, but you could see changes over time. And that's what the brain maps are allowing us to do, is get a feel for what the underlying dynamics are through a treatment arc. And that's it for me. That's all I had.
Okay. All right. Okay. That's I can't thank you enough. I mean, you're the person I've been trying to talk to for I don't know how long.
I appreciate your patience. I am.
But I don't. When we have I don't want to interrupt too much, but I'm very, very interested in your production and what you're doing, and your appreciation. The perspective of people who work on the brain is important.
Yeah.
When they see the change and they talk about the change, and what are they? You're actually clinician. You're actually in there doing something.
Yeah.
So you're doing something, make a change, monitor, make a change. And so if we had Dr. Henning on, who was just asking his patients, depressed patients, how you doing? Good. Okay, a little bit more. How you doing? Good. Okay, a little bit more. How you doing? Okay, a little bit more. And I think, I'm going to pause here. I think that what you kind of both touched on was that we're having an electrophysiologic, electric, and metabolic change when you put light on somebody's head. Mm-hmm. And you are using the infrared light, right, Penijean? And
yes.
So you were seeing these changes happening, and I know that you're working on this very diligently, both of you, measuring and monitoring the changes in brain function as you put light on them. So let me open it up to you both to just talk about whatever you can talk about in the future. We don't want to go to Area 51 if we can't go there. But what do you think is going to be happening in the next 10 years? How do you think this is going to work? Are we going to be able to pull up our phone and dial in, and I'm going to be happy, or I want to be calm? How's this going to work? Tell me what you see. Go ahead, Thomas. You go first, please.
Well, predicting the future is always a little bit difficult, of course. Who knows what's going to happen? Um, I would say that this is all going into, it will definitely be more possible in the future. We will have much more opportunities. I think combination between EEG and light. Light has a great future. Stemmed light, infrared light will be really, we'll see more in the future about this. And well, I see this is for me, that is the most promising technology. Besides, we see TDCS, for example, and we see PEMF, but from my perspective, I would say the light has the greatest potential of making much more people, yeah, because it's so easy to use and well, we still see not everybody getting better from it, but a lot of people have benefits, and with research, and of course we need much more research, but with and this will happen, of course. So we get more and more experience about it. We will know which frequencies work. Probably we'll find out ways how to individualize the treatment for people. So EEG will still have a great importance for that, because people will have, we need to measure before we optimize the protocols. Well, and then there will be hopefully devices that combine the approaches together. And yes, so the future will look much. I'm very optimistic about that. It will be better. It will be better and better devices and treatments.
You talk about a personalized approach to the therapy. Yeah. I think is what you're describing. I think that's a viable. One person made the representation, says, well, Joe, if you turn and you look back 10 years, what did we know about brain and transcranial photobiomodulation in 2010 versus what we know now? The changes in the last 3 years have been so accelerated that that's what really makes it hard to pick the end point for 10 years from now. But the point is, we have someone and the camera who's constructing that future a little bit. So let me turn it over to you, Penijean, and tell me how it's going to play out.
Sure. I've got about 60 seconds before I've got to jump off here. I've really been enjoying the last couple of years working with a handful of different companies and vendors and clinicians who are all starting to really jump on the integrated model train. And so there has been, I think, a real groundswell in the quality of the technology that we have available. So as the quality has increased, our ability to do something useful and combine it has also increased. And I've seen a lot of just really solid work coming out of brain-computer interface, fields, and people who are really interested in thinking a little bit out of the box. So I'm definitely finding people to work with, whereas 10 years ago, I was just getting burned at the stake. So now I'm really seeing some shifts in creativity, and that's very encouraging.
Positive. Thank you so much for your attendance, everybody. Peace.
Absolutely.
Totally agree.